ahead now and move into the treatment section of our progress note and talk a little bit about using eCLINISENCE. Now, eCLINISENCE is a tool that gets a sense of how you treat your patients. So accessing eCLINISENCE, what we're going to see at the top is the assessment that we've made for our patient. And of course, if we have multiple assessments, those will be displayed for selection. And it gets a sense of how you treat your patient in the sense that it keeps track of any medications that you've ordered in regards to that assessment, labs, diagnostic images, and any notes. Now, it's not anything that you're customizing. It's based off of your using the system. So the more that you use the system and create a treatment plan for your patients, it's going to remember that, and then you can generate the list here so that it gathers all of those medications, those labs, those images, those notes that you've included for that particular assessment and displays them here. Now, eCLINISENCE can be used for patient-specific. If I choose and select the checkoff box, it displays with my patient's name, the assessment, and for this patient, it's only going to display those medications, labs, images, and notes that I've specifically prescribed for this patient with this assessment. If I'm just interested in seeing overall any patient that I've diagnosed with low back pain, what were those medications? What were those labs? I can uncheck this box, and in which case it's going to show me everything. Now, to the right of that, I can filter down by provider. It, of course, defaults to my name, but if I want to see what some other providers were prescribing or ordering for a patient with this particular assessment, I can view those. Or I can always say all so that I can display everything, any provider that has ordered anything for this particular assessment. So I have the options available there. For your medications, you can show just the recent ones. You can show unique ones. So if there is any duplicate, it eliminates the duplicate. So that takes into consideration the properties. If there is the same medication name but different properties listed, well, it is going to be listed here because it is unique. They're not perfectly matching. Okay, so that's show unique RX. And then show all RX allows us to view all prescriptions, all medications, anything that we've ordered for any patient. So you can pick and choose how you want to filter for your medications. What you'll also find are these delete buttons within each of these sections. Use that with caution. So if I go ahead and select one of these medications and I say delete, it's going to give me a warning. Are you sure you want to delete? It will delete this medication permanently for the associated assessment, and it can't be generated again for the same assessment. So use that with caution. If you delete it here, now, and it's removed from the list, and further down the line you decide, oh, you know what, I want that medication back into eCLINISENCE, no matter how many times you generate it, it will not appear here for that particular assessment. So use this with caution and be aware of it. So you can select the medications you like to prescribe. Same thing with your labs. You can go through the list, select what you want to order, and don't forget you do have the delete buttons in each of these sections, and they work just the same way as the medications. If you delete them here and now, they can never be generated for this assessment again. So select the things you'd like to order. You'll also find with your notes, any notes that you've entered in the treatment screen can be included. And from there, you'll hit apply, and that's going to apply into your patient's progress note. eCLINISENCE also allows you to order outgoing referrals, so while you're at it, you can select outgoing referral, fill in what you need, and hit OK, and that will save the information for your outgoing referral. The final thing that I want to show you about eCLINISENCE would be the Generate History By. So the Generate History By, this is based off of the assessment. You can choose ID. Now watch what happens above when I'm selecting these items. When I choose ID, it eliminates codes, and it's just looking specifically at that ID itself and then generating the list, so any medications, labs, images, and notes. Or I can base it off a code, so it gives me the specific code, or I can say group, so it just gives me the grouping for that particular code and generates the history that way. So you can pick and choose how you want it to be done. And once you've selected generate and it pulls open and updates the information, it lets you know it has been done successfully. And it also updates the date and time in which it was last generated for you, so you can always keep track. So that's what you'll be able to see with eCLINISENCE. Now, while we're in the treatment screen, let's go ahead and talk about